Thank you. As Ms. Hall said, I'm a professor at Meharry. So a lot of people don't know that Meharry has a public health program. We have a Master of Science in Public Health, um, where we do a lot of work with health disparities and health equity. So the reason that I'm here today is to sort of introduce some of those concepts. I'm excited to learn that you all will be doing a photo voice project. We actually do photo voice projects with our students. It's a great way to sort of educate folks and using modern technology to sort of document issues that you want to sort of bring attention to. So I heard that you all will be doing your project and then having some sort of display here in the health department. So I'm looking forward to that, and I'm hoping that our conversation today will begin to inform how you're thinking about this particular issue. I have these slides to kind of guide our discussion, but I certainly don't want to just be the only person talking during this time. I do hope that there will be some takeaways. So certainly some definitions, the definition of health equity. And we're going to talk about the relationship between health equity, health disparities, and the determinants of health. I think those are terms that, we throw around a lot. So it's important that we are on the same page with regards to those. Then we're going to talk about historical, social, and political factors impacting health equity, particularly here in the city. And then finally sort of finish up with strategies for achieving health equity. So, for people who feel health equity is an issue that I'm impacted by, that I'm affected by, and I want to do something about it, we'll talk about places maybe where to start. I mean, I think photo voice is a great place. There are other things you all could do with your energy since you're young. So we're going to take a little quiz. It shouldn't be too long, but think about some of these issues. So first question, children living in poverty are how many times more likely to have poor health compared to children living in high income households? What do you think? Okay. 7. Okay, let's see. Well, the answer is 7. So children, are most vulnerable. They're susceptible to substandard housing, poor food, bad schools, unsafe streets, chronic stress. But when we think about the effects of childhood poverty, they're cumulative. So they sort of pile up and influence adult health. So if you had a lot of struggles, if you started off in poverty, then the likelihood that you'll see impacts of that in your adult life increase. Next question. African American males in Harlem have a shorter life expectancy from age 5 than which of the following groups? Japanese, Bangladeshis, Cubans, Algerians living in Paris, all of the above. All of the above. Yes. So if we think about the issues related to premature death among African American men, we find that they're living in poor, segregated urban neighborhoods, but heart disease, stroke, and other chronic diseases are really impacting people, especially African American males. So one other question, on average, how many more supermarkets are there in predominantly white neighborhoods compared to predominantly black neighborhoods and Latino neighborhoods? About the same, twice as many, 4 times as many, 6 times as many. Okay, let's see. 4, you're close. Predominantly black and Latino neighborhoods have more fast food joints, liquor stores, but oftentimes when you try to see if there are grocery stores and places where people can get, fresh, healthy, affordable foods, they're not really present. And even in our city, we're kind of struggling with this whole thought of food insecurity and food deserts, where you have neighborhoods that really don't have access to grocery stores. That's really not fair. On average, which of the following conditions is the strongest predictor of your health? Whether you smoke, what you eat, whether or not you're wealthy, whether or not you have health insurance, or how often you exercise. Okay, let's see. Yep, whether or not you're wealthy. Seems unfair, doesn't it? The wealthier you are on average, the better your health. From the bottom all the way to the top, genes, diet, and exercise and other behaviors are important, but a poor smoker still stands a greater chance of getting ill than a real smoker. So oftentimes when we think about, evening the playing field, it really does come down to wealth and SES and those types of things. And even that isn't fair. So how'd you do? I think out of the questions, maybe 50-50? Yeah, 50-50, good. So I think keep some of these things in your mind as we go through some of these definitions and talk through these issues. So these are the three terms that I really want us to focus on today: health disparities, health equity, and social determinants. And I'll kind of move through each in turn with definitions and sort of some discussion points. So this is a Robert Wood Johnson definition, health disparities. Now I'll make these slides available, so don't feel like you need to write everything down. But a difference in rates of illness, disease, or conditions among different populations. And we we oftentimes think about racial health disparities, but there are gender health disparities. There are, regional health disparities. So it's not always about race, but it's anywhere that you see that there's a difference between, people. But it doesn't always have to be race. We talk a lot about race, but certainly that's not where the discussion should end. So I have a couple of definitions for health equity. Achieving the highest level of health for all people. Health equity is focused, it entails focused societal efforts to address avoidable inequities by equalizing the conditions for health of all groups, especially for those who have experienced socioeconomic disadvantage or historical injustices. And that's Healthy People 2020. Healthy People 2020 is a document really that the government prepares to sort of give us guidelines and benchmarks for, what we want our health to look like. So if you haven't taken a look at Healthy People, I think we're still in 2020. It might be useful to sort of see what some of those goals are. So, thinking about how many people smoke, how many people are overweight, how many people have access to insurance, those types of things. Healthy People 2020 sort of gives us guidelines. And then because you're here at the health department, you can get data to see where we are, just for the city of Nashville. How do we compare with those national guidelines? That might also help guide some of your decision making as you begin to work on your projects. A little bit more about health equity. It's achieved when every person has the opportunity to achieve his or her full health potential. No one is disadvantaged from achieving this potential because of their social position or other socially determined circumstances. So health equity means that really the playing field is level, right? And we all have the same opportunity to be healthy, okay? The flip side of that, so sometimes you may hear people talk about health inequities, and really it's just the flip side of health equity. So a definition from Margaret Whitehead: differences in health which are not only unnecessary and avoidable, but they're unfair and unjust. And so we'll talk about some of those issues around these differences really not being fair. So thinking about health inequity, there are essential elements across all definitions. Health inequities are unjust, unnatural, avoidable differences in health status, the distribution of disease. So that's, when you're looking at different groups of people, why is it that, Native Americans have such struggles with diabetes? Why is it that African Americans, have such struggles with hypertension? Trying to understand why that is. Also considering mortality rates across populations. And mortality rates, that's just looking at what people die from, okay? And, you know, we see in certain populations, like take breast cancer, for instance. There's a real issue with African American women and breast cancer. So we might be less likely to be diagnosed, right? But more likely to die from breast cancer, right? And trying to understand that, it doesn't really seem fair, right? And what causes that difference, okay? Health inequity, so more about the definitions. Health inequities are beyond the control of individuals. Usually they're systematic problems, okay? While individual choices influence health, these patterns across populations are not a result of individual choices alone. So if we think about, you know, what puts people at risk for being sick, certainly there is your individual behavior. So the choices that you make. What do you eat? Do you exercise? You know, those are the things that are sort of under your control and would contribute to the likelihood of you, you know, getting sick or getting a disease. There's also genetics, and there's not much that we can do about genetics these days. Who knows, maybe one day, you know, everybody can, you know, wipe their genetic slate clean and have it reprogrammed or something. But, you know, we kind of come into this world with a set of genes that are, you know, sort of predestined from our folks. So, you know, if your mom has had, you know, breast cancer, or you know, aunts, that type of thing, then the thought is that maybe your genes would probably make you more susceptible. So now we have your genes. Then let's say that you don't eat healthy, maybe you're overweight. You know, that's your behavior. So those things impact the likelihood that you might get sick. But there are all these other factors out here in the world that are also impacting whether you might get sick. So it's more than just, did you make the right decisions with what you ate? Did you know, do you exercise, do your genes? There are other factors that sort of impact your risk as well. And if we think about health inequities, they're sustained over time and persist throughout generations, and we'll talk about some of that. So as we think about how to achieve health equity, we have to, you know, first agree that our work should be driven by values of social justice. And so that means, you know, the equitable distribution of resources. So if you live in Brentwood and you have access to X, Y, and Z, even though I live in North Nashville, I should still have access to X, Y, and Z, making sure that things are distributed fairly. We're focusing on outcomes rather than problems. And we're focusing on structural and institutional changes that address the conditions that produce illness and disease. We'll talk about these a little more specifically. So, principles of health equity. It's a cross-cutting broad issue associated with fundamental social values and well-being. Health equity is connected to all aspects of public health work and the most basic influences on the health of populations. And if we are to achieve health equity, we need a multidisciplinary approach. And so that means we need people from all different walks of life, all different types of jobs, really thinking about the issue, partnering, working together to sort of level that playing field, okay? We need a more holistic, comprehensive view of health and coordinated strategies. And so when we talk about a holistic, comprehensive view of health, you know, health really is physical health, mental health, spiritual health, financial health. You know, sometimes we get bogged down in, you know, do you have an illness or not? And it's really beyond that. So that holistic approach would take all of those things into consideration when we're thinking about, well, you know, what does a healthy person look like? Sure, they're free from disease, but, you know, maybe they're connected spiritually. You know, what's their social support like? You know, are they financially fit? Do they have a job where they're able to make a living wage? I mean, all of those things kind of contribute to, you know, this picture of health that we say we want everybody to have access to. So let's think about health inequities in our community. I mean, because I think there's a lot of things that are happening in the city that are concerning. Any thoughts come to mind from you all? You know, thinking about issues where there's some unjust situations going on that might be impacting people's health. Sure.
There are a lot of food deserts.
Yes.
I could name certain areas.
Yep. And we have a lot of groups in the city that are partnering, trying to do something about food deserts. There are a lot of interventions that have been tried, to alleviate the problem. And it's getting a little better, but I mean, we still have a lot of work to do. Any other thoughts about issues in the city?
My school team box is right in the middle of downtown, and there's a lot of homeless people.
Yep, homeless and health issues are just homeless folks are faced with so many health issues in general, but access to health. I mean, if you're wondering where you are going to sleep at night, right, then do you really have time to think about whether or not what you're eating is healthy or not? So, I mean, absolutely. So let's think about census tracts as it relates to, the city of Nashville and where we are. Unfortunately or fortunately, depending on where you live, address is the most powerful predictor of health status. And in Davidson County, we have a prevalence of chronic disease that varies by census tract. Some tracts where the average person in normal weight compared to others where the average person is overweight or obese. Then premature mortality, and so that is early death, right? Dying earlier than you should, right? Varies by neighborhood. So if we were to compare, death rates for people who say live in Bellevue compared to death rates for people who maybe live in Bordeaux or North Nashville, you'd see a marked difference, right? Unfortunately. And then most health problems are present in areas with high poverty rates. And high poverty usually means a decrease in community assets. When I say community assets, what do you think about? What comes to mind? Sure. So it might be, clinics. It might be parks. It might be rec centers. It might be green space. I mean, so there's a lot of things that we can think about, that create assets in communities. And unfortunately, oftentimes they're sort of sparse in one neighborhood, usually low-income neighborhoods, and overly abundant sometimes in more affluent neighborhoods. So again, thinking through historical issues in our community, and there have been several. I mean, we can kind of talk through some of these. So discriminatory mortgage underwriting by FHA and VA. So just, and this is kind of systematic, because these are sort of organizations that are controlling whether or not you can get a mortgage, right? And making those decisions sometimes based on race or other things that doesn't really seem fair. So the likelihood that you're able to, buy a home. And for many, if you think about, building wealth, it's oftentimes related to real estate. And so if there's a system that keeps a certain group of people, out of the loop of becoming homeowners, then that, attributes to health inequities and just kind of an unjust situation. Yes?
I think that middle class and light flight to the suburbs is one that's really affected Nashville.
Oh, absolutely. Yep, absolutely. But what we're seeing now is sort of a move back, right? So yes, people decided I don't want to be in these neighborhoods. The people who are moving in don't look like me. It's changing, and so I'm going to move out, right? But now a lot of folks are like, oh, I want to be back in the city. So we're seeing neighborhoods change, and where people who may have had sort of a lower income are now being forced out. And, people with resources and great jobs, now they want to be back in. And so it's kind of, down here in the bottom where we talk about displacement, urban renewal projects. But the one thing that I think we don't think about is when people with resources move to the suburbs, they have the resources to sustain living out there. They have cars, they have, good jobs. And so it doesn't really make a big deal that maybe it takes me 30 minutes to get back in town to my job. But when poor people get displaced, they don't have the resources then to sort of sometimes get back into the city to have access to their jobs. And if we think about, Nashville is a wonderful place to live. I'm, born and raised here. So, some of this stuff is a little troubling to me, as it would be anybody, but, we don't have a great public transportation system. And so, we're displacing these low income folks, and then we really aren't, there's no infrastructure in place, no systems in place to sort of help them be okay back out there in the suburbs. So, that's a really big issue. And I think, fortunately, it's on the radar of government and they're trying to do something about it. Unstable and changing labor markets. Are you employed? Are you underemployed? So that means, maybe you've been to college, but you really haven't been able to, get a good job where you can, afford to take care of yourself. Nashville has morphed into, while it's a wonderful city, it's so expensive, right? And even for our students that want to come to school here, a lot of them say, I can't find an affordable place, to live. So thinking about somebody I was just talking to, like a rent of $1,500, my God, that's a lot to pay for rent, Then you have the situation where, oh, well, it's cheaper to buy, so certainly if I were gonna need to pay $1,500, I'd feel better doing that if I could be purchasing something. But now thinking about mortgages, am I able to even, to get a mortgage to purchase? And are there sort of underlying things that are keeping one group of people from being able to secure a mortgage versus others? So, all of these things sort of create a situation where health issues can, thrive. And we'll talk more about that. Industrial and toxic waste facilities in high poverty neighborhoods. And we've seen a lot of that in North Nashville neighborhoods. Controversies about, where people want to put dumps and, what companies are doing. And, the thought that sometimes these untoward things are happening and companies just aren't really holding up their ethical side of the bargain, but they're doing things in neighborhoods, where if it were Brentwood or Bellevue or, any of the sort of posh areas, that we think about, they wouldn't dare be able to do that. Or the likelihood that they would even be able to set up shop in some of those neighborhoods, is very unlikely. So all of these things, impact our community and ultimately begin to impact our health. So take a look at this graphic. I think it really, brings home some of the things that we've been talking about. So take a look at it and give me some of your impressions. Our environment's we're going to end this on a positive note. So don't, it is a lot sort of to take in, but we will end our discussion on a positive note. Our environments cultivate our communities, and our communities nurture health. And so, on one side we have a tree where inequities are present, community assets are low, and you see, all these health outcomes starting to create problems. Then on the other side, we have an example where a community where inequities are low, community assets are high, and health tends to be better. So it's depicted by, a flourishing tree versus, a tree that's really struggling. So thinking about looking at what's in the soil. And with the example where community assets are high, there are quality schools, access to healthy foods, access to recreational facilities. People are making adequate income. And we talk about a living wage, or even if you do the math on a living wage, thinking about a city like Nashville where your rent might be $1,200, even a living wage seems like it's not really enough, for people to live off of. But, where assets are high, there's access to health insurance, it's a clean environment, there's quality, affordable housing, there's access to health care, there are jobs, there are, transportation resources. So as we look at the trunk, in this flourishing tree, because we have all those things, at the root, kind of underlying, present in our community, then we're able to establish a sense of community. We have social networks, social support. We're connected to people that can help us. Communities are actively participating. Folks care about what's happening in their community. There's a lot of participation. When I think about schools, I have a friend of mine who lives in not such a great area, but we talk about our experiences even with the public school system. Where I live, I'm so fortunate because our public school, the parents are very involved, we're very connected. The school has a lot of resources in addition to the resources that are, provided just to all public schools. But in her community, she's always just so shocked at what the parent group is doing and, the things that are available at the school. So it really begins to make a difference in how we think about our communities. And interestingly enough, we don't live that far from each other. If you think about, where I live and where it's not like we're way across town from each other. We're really not that far from each other and have two totally different experiences as it relates to public schools. And, our thoughts about the quality of education that our children are getting. So that should be fair across the board, regardless of where you live, regardless of who you are. So in communities with high assets, we have, leadership, there's political influence, there's organizational networks. So organizations are present in our community that are helping to build up the community, okay? And if we think about what all of this, so, our roots are strong, our trunk is strong, and then how does that sort of relate to health outcomes? You probably see decreased rates of obesity, decreased rates of stress, infant mortality numbers are better, and infant mortality is the number of children that die before their first birthday, okay? And typically, infant mortality tends to be better in better neighborhoods, more affluent communities. In a thriving community, we're probably not dealing with, issues related to HIV/AIDS. Not to say that HIV, that there may not be people in the community that have the disease, but they're able to manage the disease and probably live a better quality of life because of the resources that are available in the community. Nutrition is better, so not to say that those issues aren't present in our communities that have high assets, but we're able to deal with them differently. We're given a different set of tools. So, any additional thoughts or reflections as you look at this picture?
I see a lot of factors in
Mm-hmm.
A lot of this comes down to how much you have.
Mm-hmm.
That relates to how many resources you
It does. It does. Yeah.
Also, it seems like if you don't have a lot of money and you live in a place without like nice grocery stores and such, in order to go to the places like Vic or like whatever I forget, but to go to those places to help you,
Mhm.
in a rich neighborhood, you have to wait for the bus, and what if
Mhm.
that's irregular,
Mhm.
and then it's all this power that would have been in your control is now even farther out of your control.
Absolutely. Yeah, absolutely. I think that has a lot to do with it. And were you talking about WIC?
Yes.
Women, yes. So women, infants, and children. And a few years ago, there was a little bit of drama about WIC here at the health department because I think they were moving the sites, where people could go to actually get the food. And I think it was, going to be really difficult for folks who have could get that benefit to actually maybe get to the places where they needed to in order to sign up and get their vouchers and all of those things. So we have to think about that. In situations where we have a resource, but are we creating barriers unintentionally for people even to benefit from the resource? So excellent suggestion. So what's the difference between health disparities and health inequities? In my recollection, really it's this concept about things being unjust. So we talk about health disparities a lot. I mean, it's just differences, right? So why, are, black women more likely to die of breast cancer? I mean, it's just the differences, however we want to categorize those differences. But when we begin to think about health inequity, we're looking at the differences, but we're also recognizing that the differences are unjust, unnatural, and avoidable, okay? So what links the two? What links health disparities with health inequities? And this is another thing that, a concept that I think is, really important. It's the stuff in the universe, the background, that's really driving these differences, and the things about our community that make situations unfair. Okay, it's the things for many of us that are out of our control. So yes, I can control my behavior. I can stop smoking. I can exercise. I can eat healthy. But even in my decision to do that, social determinants of health will either facilitate those changes or create barriers for me. Okay, and we can kind of go through these in turn. So income and income inequality, right? We see that with gender. We're doing the same job, but men get paid more. Why is that? That's unfair. And what can we do to, equal the playing field? Okay. Education. What kind of education do we have access to? Public education is great in some parts of the city. In some parts of the city, it's not. It's unfair. Right, education should be the same for all. There's drama around the issues related to charter schools. With are we sort of diverting public school resources into these charter schools, and then we're limiting the access of the types of people that have the ability to be educated in this charter school system? And we have to think about, those things. And while there's certainly benefits to charter schools, if you think about people who, are a little nervous about charter schools, it's like, well, you're looking at the school, the people who are at the school, and there's no diversity in the school, but we're using public school dollars, right, to fund this school. But we've limited access. So, thinking about those things. Race, ethnicity, gender, and, any related sort of discrimination. So, when people are treated differently because of the color of their skin, or because of the fact that they're women. Built environment. So what do you think of when you hear the term built environment? Mm-hmm.
Sorry, roads, infrastructure.
Sure, absolutely. So, do we have sidewalks in our communities? Do we have access to green space in our communities? What our neighborhoods look like? Are they healthy? Are they appealing? right? All of those things kind of speak to built environment. I tell a story sometimes to my students where, we talk to folks about, oh, you should exercise. And, if you don't have money to go, to join a gym, just exercise in your neighborhood, walk. Well, maybe it's an unsafe neighborhood. Maybe there are no sidewalks. Maybe the neighborhood has an issue with stray dogs that make it, unlikely that somebody would feel comfortable, walking. I bet if we looked at the stray dog problem in the city, it's a little different in some of the poor neighborhoods than it is in the more affluent neighborhoods. And why is that? It should be the same, stress. Some people think that stress doesn't impact people as badly as it does, but it really can change everything. Just this constant background of being stressed out, worrying about what am I going to eat, if I make enough money, even stress from racial discrimination. It kind of is in the background. And there's a lot of people that think when we look at these differences, really it's the level of stress that's driving a lot of this, because certain groups just tend to carry a lot of stress, right? So social support, so that's who we're connected to, who in our lives can support us. Think about if you were trying to quit smoking. So I've made the decision, yes, I'm going to change my behavior, and I can do that. I'm in control of my behavior, and I'm going to quit smoking. But I happen to be married to a smoker, right? Is my immediate, my significant other, is he going to be helpful, social support, is he going to be supportive of my efforts to quit smoking? Maybe, maybe not. But if he doesn't quit with me, the likelihood of me being successful is going to be very low. Actually having social support, and resources for social support can impact health. Early childhood experiences. What happened to you when you were growing up? There's this concept right now that everybody is really interested in. It's called ACE, Adverse Childhood Experiences. And it's actually a little questionnaire that you do. It's about 10 or 12 questions, I think. And, they're asking, has anybody in your family been in jail? Have you been exposed to abuse? Just these series of questions. And there's research that has shown if you have a high score on this ACE quiz, then, the likelihood of you being unhealthy, the likelihood of you, struggling with chronic disease is higher. So to think that things that happen in your childhood stay with you and impact your adult life is really very powerful. So, yes.
Also, my mother's in early education. So
Mm-hmm.
you know that. But I think also, if you have a sense of security just in your first
Sure.
year of life where you can't even remember it,
Mm-hmm.
that sense of whether you were held or whether people came to you when you cried,
Mm-hmm.
and I'm not sure how much this relates to poverty.
Mm-hmm.
That it can shape your whole outlook
Mm-hmm.
on life
Mm-hmm.
for the rest of your life.
Absolutely. I definitely believe that. Issues around employment. What kind of jobs do you have access to? Again, are you underemployed? Are you working a minimum wage job? Or are you, comfortably in the six figures? That's going to change what your health, maybe change your stress level, change, what you have access to, and ultimately impact your health. Housing issues. We've talked about, the issue in the city with affordable housing, but then also just quality affordable housing. I have another friend, and I'm, even to recant this story is so painful. She, single mom, she works. She has an okay job, and lives in not a great place. And who knows who her landlord is, but she actually injured herself stepping into her kitchen, and she fell through the floor. Not like totally, but like, one of her legs. So quality housing. So not just housing, but quality housing. So, thinking about people in the city who have rental properties and they're not, keeping them up. So yeah, so you may be charging people $700 or $800, which seems more affordable compared to $1,200 or $1,500. But then what's the quality of that housing? Everybody has the right to have access to quality, affordable housing. So transportation issues, and we talked about that. Nashville is not a public transportation city. I mean, there's all different proposals that are going forward to try to see if we can improve this. But this is the kind of city where you really need a car, what I'm saying, to kind of get from point A to point B. And even with the bus system, for many folks, the way that it's designed is just not really user friendly. So our food environment, we've talked about that, food safety and food deserts, and understanding that those issues again are usually found in these lower income neighborhoods. And then finally, social standing, and I think that's kind of a combination of a lot of these things. Where were you educated? Where do you live? Where do you work? Are you in charge at work? Or you kind of lower totem pole, kind of person at work. So all of these things, and this by no means is an exhaustive list, but these are the things that shape the decisions that we make. Oftentimes it shapes the decisions that we have, it shapes the options that we have access to. But then also it shapes the decisions that we make, these determinants that are in the background. Some people can rise above these things, right? And some people can't. They're really at the mercy of, social determinants. So I know that, some of this has maybe been disheartening, especially if it's the first time that you're sort of hearing about some of these concepts. But I think, our next part of the conversation is thinking about what we can do to sort of be agents of change to improve health equity in the city. And then also as you all prepare for your projects, for your photo voice projects. So here are a series of steps, and we can talk through these in turn. Create or enhance your partnership. So as you think about your project, are there any strategic partnerships that you think might be beneficial as you're thinking about creating your photo voice project? And you all know photo voice is really just using pictures to sort of document issues of inequity in our community. Okay, maybe so, yeah. I mean, you're certainly a part of one great partnership here at the health department, but there might be others. Any other thoughts? Yeah, maybe so. Maybe so. Well, but I mean, you will be creating art, with your photos. So that really might be an interesting partnership, to have a little bit of space. I mean, I know you'll probably do something here, but even working with the FRIS and have a little bit of, and, maybe have a moving display, that goes across different organizations in the city, partnering maybe with churches, with schools, so the thing is, when we achieve health equity, it's not going to be done, with us kind of staying in our individual little silos or our individual little groups. We're really going to have to get out and partner and work together. So, focusing on social determinants. So remembering those, that stuff in the background, right? That's shaping people's decisions and shaping people's options, shaping their decisions, right? And understanding that, for many, social determinants of health, they're beyond our control, and they can really be wreaking havoc in our lives for a lot of people. Building community capacity. When we talk about that, that's really ensuring that the community has the skills that they need to do the work, right? So even in this, asking you guys to begin to use photo voice, there's some capacity building or training that has to go along with that, helping you to understand issues related to health inequity, but then also maybe understanding how to do photo voice. What's the purpose of it? What to be thinking of as you're making your decisions. So, that's kind of what capacity is fancy way sometimes to just think about training and make sure that people have the skill sets that they need. And then really understanding though that we all come to the table with certain skills, and so mine won't outweigh yours and yours won't outweigh mine. But as we're sorting out this partnership, honoring everybody's strengths and skills. And I think that's a part of it too. Selecting your approach for change. So what is it? What is it that you think you want to do as a part of a group, as a part of a partnership? Bringing attention to an issue is certainly a great first step, but there may be other things, other action steps that you want to think about as you move, forward. So, with regards to your photo voice project, that's your approach, I would say, right, in this scenario. Thinking about who you want at the table, the messages that you're given, who you want to make sure sees these pictures, right? It's going to be great to bring awareness, but you also need people at the table who can make some difference. People who have a little bit of control that can actually change things, right? And then, move to action, and that's really doing the work, having the energy, the equipment, the skills that you need to actually put that approach in play to actually do the work, and then documenting and sharing your work. Photo voice is a wonderful vein for that. You're going to document your work with photos, with pictures, and thinking about how to share it. So I think that would be great, though, really, if you could, let your photos kind of move across the city. And there's some places where, that might work. I mean, could work out something with. I hope I'm not speaking out of turn, but there's spaces over at Meharry that could probably lend themselves to an interesting sort of display. Metro General Hospital, so that might be, as you think about your approach and action, so, doing it here, but then also letting it move throughout the city. I mean, I think that would be really powerful. Then the next thing is maintaining your momentum. And I think that's really important. So you guys are young, so I'm not concerned about your momentum quite yet. But, making sure that you have the energy for the job. So I'm in public health, and I do a lot of health education. And I spend a lot of time thinking about how to present information to groups of people in a way that'll be engaging and, help them to see the light, change your life, make these, drastic changes that will help you reach this optimal, health that we always talk about. But at the end of the day, some people do it, some people don't, But I can't pack up and go home and not continue to do the work. And so I think maintaining your momentum has to do with keeping yourself energized and understanding that if you do the best work that you can and you just get one person to change, that's really enough. Oftentimes it's more than one, but even in instances where it's just one, that's enough. But you have to do what you need to do to be able to sustain your work, okay?
I think just to add on to that,
Sure.
maintain momentum for a group, such as young people.
Oh, sure.
Because they transition, they go off to college,
Mhm.
they may come back, but then who's there to carry the weight of
Mhm.
the
Mhm.
banner forth, so replenishing young people to, who have the same kind of interest in
Absolutely. Absolutely. And then, it has to do with sustainability. So we talk about that a lot. So think about situations where, and this has happened really in the city, you're given government funding or grant, to do a certain type of work. So, let's say to address diabetes related health disparities in North Nashville, you're given a lot of money, right? And you do all these wonderful things to try to help people manage their diabetes better, to educate people about, all of these things. You might even, do some structural things to even the playing field and, make sure that access to, medical care is better, all of these things. But then when the grant ends, all of that work ends, right? That's a problem. So sustainability is this idea that Well, yeah, we had this grant and we're laying the foundation, but this work can continue to go forward when this grant is finished. So we talk a lot about sustainability. Sustainability is hard without any money. I mean, I'll be the first person to tell you that. But we have far too many examples where we've had pockets of money, we've done great work, and then the money is gone and then everything stops. So, for us as we're thinking about our momentum, it also relates to sustainability. Do we have the infrastructure in place to sustain what we're doing here, to sustain, this training and education process? And I think with the Youth Advisory Board, there is that infrastructure. I mean, it's part of a larger organization that probably won't be going anywhere anytime soon, and there is that procedure to continue to get new and interested people at the table. So, I think that becomes important as well. So I'll just end with this. It's a quote from Martin Luther King. I think it's timely. As we're just coming off of MLK Day, and then also with the inauguration, and people's feelings are all over the place about the inauguration. But so one of all the forms of inequality, injustice in healthcare is the most shocking and inhumane. Right? People really should have the right to affordable, accessible health care. And as we, work together to level the playing field, to, do away with some of these inequalities, I think that we have a shot at really sort of reaching these types of goals that have been laid out for us, by leaders of yesterday. So that's all. Any questions or concerns or issues?
I was just wondering how much of does the government play a role in this as much as the community? Or is there like higher powers?
Well, anytime you think about structural issues, I think government has a little bit of a role in this too. Anytime things have been set up to sort of advantage one group over another group, it's unfair. And unfortunately, we have examples where our government has kind of had a role in that. Then sometimes we see instances where things are put in place, so resources are put in place in order to sort of, level things. But I think the government certainly could help as we think about how to really make sure that resources are distributed fairly, access is fair. Absolutely. Mm-hmm.
Would you say it's true that a lot of the ability to progress on certain kind of specific issues is related to whether you have the right connections?
Mm-hmm.
That's kind of complicated because it seems like everybody has this social network.
Mm-hmm.
It's pretty, I think there's a certain extent, it's not intentionally exclusive, but the people you have overlap with,
Mm-hmm.
it's a little culture of bacteria in a peach tree,
Mm-hmm.
and
Mm-hmm.
it's never really, do you have any ideas for how to get it so people who wouldn't otherwise overlap
Mm-hmm.
something?
I think the first step is realizing that, this isn't really fair. You know what I mean? And then thinking about ways to open up those networks, And it may be something that is done just one person at a time, saying, well, this is a resource that I have, but I'm wondering if I could share this resource. I think even that thinking is the type of thinking that we need for people, to really believe if we're going to do something about this. But oftentimes, and I think that, we're even seeing it with our political climate, the thought that other people getting ahead or having access is going to take something away from this other group. And that doesn't always have to be the case. We really live in a world where there's really enough, but it might take people who are blessed with a lot to just share a little bit. Not everything, but just a little bit. So yeah, definitely, if you feel like, I'm a part of this network and it is providing me with an advantage, that's great. And I don't want you to lose sleep. Well, you could lose a little bit of sleep over it, but I mean, that's not really your fault, right? I mean, it's just a blessing. But how can you extend that blessing to somebody that's less fortunate? How could you create a situation where somebody that's less fortunate might benefit from that network? So, anything else?
I think this really made, I'm guessing the both of us very aware of the privileges that we have.
Yeah.
From like the schools we go to the houses we live in.
Yeah.
I was always aware of, I guess, all these examples.
Mm-hmm. I mean, privilege is a real thing, but I think if people are willing to just understand that I'm functioning in privilege, but then also think about ways to help other people, you can't ask people to do more than that. I mean, I think that's a great place to start, really. Anything else? I'll make the slides available and I'll be around, if y'all need help with anything. Certainly resources as you're doing your project, your photo voice projects. Mm-hmm.
How does receiving, I think Priya, you're a senior, so we're both thinking about going off to study things in like college and such. How does having a public, what can you do in terms of like creating change with through public health?
Mm-hmm. So public health is a really broad field.
Sorry.
It's okay. No. We can morph into a job talk. Public health is a really broad field, and it runs the gamut of medicine. I mean, we have public health physicians and nurses and health practitioners who, instead of maybe being focused so much on the individual patients, you're really thinking about the health of the community, and the community becomes your patient, and you're thinking about doing things that will benefit the community. And that may be a little bit different from how you may be thinking about just interacting with, one patient every hour or whatever, however health practitioners see folks these days. To health education and promotion, which is kind of what I do. So thinking about what are the issues that people are struggling with as it relates to their health, and are there programs, interventions, things that we can create to try to help people make better health decisions. You can be a lab scientist and do public health. You can do research and do public health. You can be a community advocate, a community outreach, person focusing on public health. But public health really, first and foremost, thinks about the health of the community, and we also think about prevention, right? So for a lot of times we talk about levels of prevention. So thinking about, maybe somebody that is at risk for a disease. Primary prevention, which is really where public health people start, says, I want to do everything that I can to try to help people to not be sick in the first place, right? Secondary prevention, and we do a lot of that, says, well, I want to make sure people, if they're dealing with something, I want to make sure that they know as soon as possible, and I want to help them to try to get a handle on it, right? Tertiary prevention, which we don't do as much, and that's like third level prevention, is oftentimes what traditional physicians and health practitioners do, because the person's already been diagnosed, they're ill, and now we want to try to help them to not get any sicker, right? So if we think about how it may play itself out, let's say with cancer, primary prevention for cancer starts with, well, let me make sure that you understand that physical activity, what you eat, what you're exposed to really affect your likelihood of getting cancer. So why don't you get a handle on those things the best you can before you even get sick, right? Secondary prevention says, well, there are screening tests. So if you would agree to, get a pap smear, get a mammogram, the likelihood that we could find something if it were there early will increase the likelihood that you probably won't have an issue with this. If we find it early, we can deal with it and you should be fine, right? Tertiary says, oh, you've been diagnosed with something. And so now I'm coming in to treat you and to try to help you to keep, from getting worse. So that's a lot. I mean, job opportunities are wonderful. We have certainly, federal jobs, the CDC, research, the National Institutes of Health is kind of the research arm of the government. So you could do that. You can teach, you can be in the community working at a health department, but you could be a physician and run a health department, or treat patients, nurse practitioner. But I think public health starts with just the understanding of I'm focusing on prevention and I'm thinking about the community. And then from there, you can really write your own ticket. Yeah. Mm-hmm.
Really diverse.
It is, absolutely. Absolutely. Disciplines within public health, I think it's worth talking about that. So I am health education and promotion, health behavior. So that's really trying to understand, why people are making certain decisions as it relates to their health, and then programming, coming up with programs to try to help them with that. But then there's a discipline called maternal and child health, which is very broad, but it deals with issues primarily affecting women and children. There's epidemiology, which looks at the distribution of disease. It's kind of math-based. Biostatistics, which is certainly math-based, and so crunching the numbers and running the numbers and, trying to understand these differences, math-based. There's environmental health, so, trying to understand the role that the environment plays as we're thinking about prevention and we're thinking about the health of large groups. I'm sure I'm forgetting some. I mean, there are a lot of disciplines. There's nutrition, thinking about what people eat, access to healthy foods. I mean, so there are a lot of disciplines within public health. Yeah. So I can come back and talk about public health too. I could do it all day long. Well, this has been great. If there are no more questions, I guess I'm finished. Yeah. Thank you for having me.